Let's talk about some of the evolution of psychiatric treatment. 7,000 years ago, we have what we call trepanation. It's the process of removing a skull, the purpose of relieving mental illness. This is to relieve headaches, as well as back then they thought mental illness was a demonic possession. In the 1600s, we have the theory that mental illness is a chemical imbalance. So bloodletting was thought to cure that chemical imbalance. Somewhat true with the chemical imbalance, but the practice of trying to treat it this way was not exactly correct. So in 1948, we have the first psychiatric medication, and that is lithium, invented by John Cade, who was an Australian psychiatrist. I believe he may have won a Nobel Prize for this. Moving forward, we have in 1950, the first antidepressant, and that was an MAOI inhibitor known as iproniazid. This was actually used to treat tuberculosis. What they saw with these patients getting treated with iproniazid, that they were happier, they had more energy. And so that's how the first antidepressant was found. In 1952, the first antipsychotic is called chlorpromazine. That is actually based out of Benadryl, first used in Paris. And the same year, the first tricyclic antidepressant was known as imipramine. And believe it or not, that came from chlorpromazine. That was the first tricyclic antidepressant known as imipramine. It came from chlorpromazine, and they noticed that it induced mania. It was the first medicine to treat depression. Cons were sedating, it is dangerous in overdose, and lots of drug-drug interactions. So nowadays, we basically just use it to help us sleep. And in a sense, it's only used when nothing else works. But as you can see, in 1987, guess what happened? All right. First SSRIs came out, Prozac. Prozac was revolutionary because it made mental health treatment a little bit more mainstream. We don't just use therapy anymore. And then there was a medicine that caused less side effects. Pros were less sedating, safer. The cons were it still took time to build up. You have your GI side effects as well as sexual side effects. So there were still psychiatric medications was not perfect.